and get started this morning, I'd like to introduce you to Rob Boner. He's one of our nurse practitioners over at our point-based office. He's going to talk to you today about bone health.
All right. Yep. So, Rob Boner, nice to meet everyone. So, I work in primary care, but I also work in the bone health clinic. And some people say, what is the bone health clinic? So, I see patients who have osteoporosis. And what is osteoporosis? I'll see the next slide here. So, osteoporosis is essentially, it's a condition where the bone density is less. Sometimes we characterize people as having fragile bones or brittle bones, and essentially the bones, a lot of people don't realize this, bone is living tissue. It's just like skin, the organs, it's living tissue. There's a process of regeneration. There's cells that break down bone and then cells that build bone. So as we age, the cells that build bone, they don't work as well or keep up with the cells that break down bone. So there's an imbalance, which then leads to this state where the bone density goes down. And it's a significant public health concern. A lot of people don't think about their bones. They think about the big things, right? Heart disease, high blood pressure, high cholesterol, diabetes, those things. Osteoporosis doesn't really come to mind to people because honestly there really isn't any symptom of having osteoporosis. The symptom of osteoporosis is breaking a bone, which is kind of too late, right? So it is a condition that's preventable, it's treatable, we screen people for it. So next slide. So how prevalent is it? 2 million osteoporosis fractures occur a year. Honestly, probably 1 in 2 women over the age of 50 will have an osteoporotic fracture. And the big one that I kind of want to point out is hip fractures. Up to 25% of people who have a hip fracture will pass away within the first year or two. That is a pretty significant statistic to me. It comes with a pretty high mortality rate, so risk of death. The people that survive a hip fracture, a lot of times they're really debilitating. I don't know if anybody knows somebody who's had a hip fracture. If you had a hip fracture yourself, it can be really debilitating. Some of these people that suffer from a hip fracture don't return to their normal activities of daily living. They can't return to independent living. They might need assisted living. So that is the one that I worry most about for people who have osteoporosis is having a hip fracture. All right, next. So who's at risk for osteoporosis, honestly? So the guidelines, the United States Service Preventative Task Force, they have guidelines on when to screen people for osteoporosis. Any woman over the age of 65 is eligible for screening. Honestly, even before that, once you become menopausal, your risk of osteoporosis goes up, so we can typically screen people for that, especially if you're 50 and older and you have some risk factors, so whether you smoke, have diabetes, certain health conditions. Women's health providers are really good about screening patients for osteoporosis. So some of you might even had a bone density scan already. Men over the age of 70, so if you have husbands that are over the age of 70, they technically would be eligible for screening for osteoporosis as well. The most common low trauma fractures that occur with osteoporosis occur in the hip and the spine. Another place that's pretty common is the wrist. So risk factors for osteoporosis. Fragility fractures. What is a fragility fracture? So if I was to walk over to Denise and trip and break my hip, that is a big red flag. That is considered a fragility fracture, so having fragile bones. If you've ever tripped and broken wrist, a vertebrae, hip, we would consider those fragility fractures. So anybody who's had one of those, that's a risk factor, and that kind of tells me, yeah, you do have osteoporosis. If you've had a parent who's had a hip fracture, mom or dad with a hip fracture, that's a big red flag too, because there's a big genetic component to it. Anybody who's on steroids for long-term use, so if you have rheumatoid arthritis and you're on steroids, if you have COPD and you're on frequent oral steroids for that, you're higher risk for osteoporosis. Anybody who smokes is higher risk for osteoporosis. People who drink more than 3 alcoholic beverages a day are higher risk for osteoporosis. If you have really low body weight or are a little bit heavier, you're at higher risk for osteoporosis. People who fall, of course, they're at risk for osteoporosis. Low calcium and vitamin D. I'm always surprised how little calcium that we actually get in our diet. So especially if you don't do a lot of dairy, that's a big one for calcium, so milk, yogurt, cheese. If you don't do a lot of green leafy vegetables, that's really rich in calcium. So if you have a low calcium intake, you're higher risk. Low vitamin D intake. If you drink lots and lots of caffeine, you're actually higher risk for osteoporosis. Now, is a cup of coffee in the morning a bad thing? No, but if you're drinking like over a pot 2 a day, that's not good. If you have certain conditions like diabetes, hyperparathyroidism, if you have kidney disease, rheumatoid arthritis, like we kind of talked about already, Crohn's disease, if you've ever had a history of gastric bypass, you're a little bit higher risk for osteoporosis just given the malabsorption that can occur after those types of surgeries. Cancers, and then certain medications. So if you're on lithium, if you're on anti-seizure medications, another common one that a lot of people are on are like PPI, so proton pump inhibitors. Those are medications like Prilosec, Nexium. They just put you at a little higher risk for having osteoporosis. So how do we screen people for osteoporosis? So I'll talk about the bone density scan in a moment here, but we look at all those things, those risk factors. Like I said, if you've ever had a parent with a fracture, if you smoke, if you've ever had a fracture yourself, we do what's called a fracture risk assessment. And anybody that comes into the clinic to see me for osteoporosis, I go through your past medical history, your personal medical history, your family medical history, and we can kind of come up with this score to see how at risk you are for a fragility fracture, for a fracture related to osteoporosis. I'll order some basic blood work on people just to see if there's any underlying secondary cause of osteoporosis. Osteoporosis is something that kind of will occur as we age, but there's also secondary causes for osteoporosis we just want to be aware of. So kind of those conditions that I spoke on before, like hyperparathyroidism, I sometimes will come up with that. I'll come across that rather, and then I need to get endocrinology involved because there is a underlying reason why your bone density is where it's at. It might be partially just because you're getting older, but we don't want to just put a Band-Aid on a situation that we could try to address the underlying reason. So I check blood count, sugar, liver, kidney, calcium, vitamin D, and then the TSH, PTH. And if there's any other thing that's kind of maybe telling me maybe you have celiac, so we'll look at that too. Next. So the gold standard is this bone density test called the DEXA. So the DEXA it's basically an x-ray. We look at your lumbar spine, we look at your hip. If you have hardware in those places, we'll probably look in your wrist. And it gives us what is called a T-score. So what's a T-score? So T-score is basically, they give us a number and they're standard deviations from the normal. What is normal bone density? So we're basically comparing it to a woman who is in their 20s. What their normal bone density is there, because honestly, when you get into your 20s to your 30s, you've reached your peak bone density, and after that, it will slowly decline. So normal is -1 and above. -1 and -2.4 is considered osteopenic. So what's osteopenia? It's essentially, I tell people, it's lower bone density, but it's not terrible. And then osteoporosis is anything less than -2.5. And that's when we can say, yep, you have osteoporosis. Like I said, generally, the average healthy person, 65 and above, we start screening. But if you are age 50 and you have some risk factors, we might do a bone density sooner. All right, next. So why be screened? I mean, honestly, it's good to know if you have osteoporosis. If you have a fracture related to osteoporosis, it's obviously painful. It can lead to deformity. There's a high risk of mortality or death associated with hip fractures. So I think personally it's just a good thing to know, because if you do end up having a fracture and there was something we could have done, we'd be kicking ourselves, right? All right, next. So there is hope. We have treatments for osteoporosis. I would say the big things that when I have patients come into the clinic, we'll talk about calcium. So how much calcium should somebody be getting? Generally, anybody over the age of 50 should be getting 1,200 milligrams of calcium in their diet, and then if needed, supplement. So I would encourage everyone to kind of look and see how much calcium you're actually getting, look at the food labels, and see how much you're getting from your diet. If you're doing a few dairy servings a day, you might be getting a good amount of your calcium. I want most of it to come from diet because honestly, it's better absorbed. But if you need to be on a calcium supplement, then and a lot of people actually end up needing to be on one, then we kind of talk about that during your office visit. But the amount that I would want you to be on is probably 1,200 milligrams. Now, if you have a gastric bypass, we'll talk about you're going to need more calcium because you're just not going to absorb as much. But in general, for the most women over the age of 50, 1,200 milligrams is sufficient. And we'll kind of talk about that during your office visit, how much of a supplement you actually need to be on. Some people find out they have osteoporosis and they're like taking too much calcium. They kind of go wild on it because they just want to try to build bone naturally. And really, at that point, calcium, vitamin D, it's more kind of stabilizing it, not really building it much more. So calcium is important, vitamin D is important for bone health. We talk about lifestyle changes. If you smoke, I'll probably ask you to try to quit. If you drink, I'll probably try to ask you to cut down on it. And then, honestly, exercise is super important. So I talk to people about exercise because we send people up to space, astronauts up to space, and they come back with osteoporosis. A lot of people don't really realize that. When you're in a state of zero gravity, gravity is pulling on those bones, and they're not getting the exercise they would get down here. So I bring that up because exercise is super important. So we talk about resistance training, even like lifting weights helps the upper extremities, weight-bearing activities, really good for the hips. During our bone health clinic visit, we'll have physical therapy come in at the end of the visit, and they'll kind of go through some things you can do at home exercises to kind of help naturally strengthen bone. And then, of course, we have medication options. So there's different medications out there. There's oral medications to the pill form. There are some that come in an IV form, injectables, and depending on how bad your bone density is, we kind of figure out which would be the best for you. But honestly, a lot of times it comes down to personal preference. We talk about the route of the medication, the frequency of the medication you'd be taking, the duration of therapy, and then potential side effects and adverse effects. And I would say, some people, they hear about some of these potential adverse effects of some of the medications for building bone, but really, if you think about it, even if you take ibuprofen, that comes with some potential adverse effects. So we always, as healthcare providers, we have to weigh the benefits and risks of a medication. So we always talk about those things, and I'll never push anybody into doing one certain type of medication. We just have that discussion because we're a team. We're trying to make it so you achieve your healthcare goals, and I really leave it to the patient to decide which is the best option for them. And then fall prevention, because that's the big thing, right? If you fall and break something, then we have problems. All right. Let's see, that might be the last one. Any questions? Yes.
You hear a lot about collagen. Does collagen work?
It's not one of the big ones that I say in relation to actually bone health. I don't think it's a bad thing. Collagen's good, of course. It's important, but the big ones that I kind of harp on are calcium, vitamin D. Some people even talk about vitamin K, but calcium and vitamin D are the big ones. Calcium's really important with building bones. Vitamin D, the reason that's important is it helps with calcium absorption. Any other questions?
So, Rob, how often should you have a bone density test?
That's a good question. So typically insurance will only allow every couple years. Sometimes if I start you on a medication and your bone density is pretty bad, I will try to get it done in a year, and sometimes I can get it approved. It's a lot of times it's just insurance dependent, but generally every 2 years is a good time to be screened if you're eligible.
So once you start taking the medicine, do you get screened more often to see if it's working?
So I would say if your bone density was really bad and I'm concerned and I want to make sure that the medication's actually working, I would probably try to get it done in about a year. If it's kind of like you're just getting into that osteoporosis range, you haven't had any fractures, I would say probably 2 years is fine. Yeah.
What if you're someone that's had several fractures?
If you've had several fractures, I might.
I mean, I know I do have it. I've been
Yes.
told that.
So sometimes we would try to, if we had started you on a medication, we would try to get it sooner, like in a year. We don't do it more than that because there's just really no clinical benefit.
So are you taking over for Jody doing bone?
Yeah, so she actually started the bone health clinic.
Right, so
And
I
then,
had an appointment with her, but
Oh, okay.
I gotta follow up with you?
Yes, yeah. So since she left, she asked me to take over it, so
Okay.
now I'm taking over the bone health clinic. Yep.
Jody's my cousin. So you said weight bearing, so walking's good, right?
Yes, walking, jogging, those kind of things.
How many miles walking is?
So that's a great question. So if you look at the studies, I looked at this meta-analysis where they looked at all this data from people that did different types of exercises, and there's no good answer for that. It's hard to actually say, oh, this person did this amount of jogging and this person did this amount of whatever type of exercise, and said they had the most boost in their bone density. It's not really a great answer, but I would say exercise in general, making sure we're doing weight-bearing activities by just walking, jogging, and then, of course, the upper extremity exercises as well. Yep.
So Rob, time wise, you say an hour, half hour?
I'd say, in general, for people, I always recommend, some sort of moderate intensity exercise, 30 minutes a day, 5 days a week.
Okay.
Yeah. Yeah.
So Rob, if somebody has a primary care physician already,
Mhm.
how would they get a referral to you for a bone density assessment, osteoporosis assessment? Would they make the referral to you?
Sure.
Or do they need to specifically ask for the referral, or how would that happen?
So if you haven't had a bone density and you kind of met some of those criteria that I talked about earlier, I would just talk to your healthcare provider, hey, do you think I should get a bone density? And if they look at your bone density and it happens to be lower, that's when they might say, hey, would you want to talk to Rob about your bones? Because your bone density came back lower, you're higher risk for fracture. And I would say even, so I said negative 2.5 and below is osteoporosis, but some people will actually meet that criteria of having osteoporosis and not even have that bad of a T-score. So like I said, that osteopenic range, so if you fall in that -1 and -2.4 range, but you have a fracture or you just happen to be higher risk for fracture, we can actually call it osteoporosis and you would technically be eligible for treatment. We used to just go off the bone density, and unfortunately what was happening is we just weren't capturing enough people, and people were fracturing. So people would break a bone and their bone density wouldn't even be that bad. So we kind of broadened the way we can diagnose osteoporosis. So even if you don't fall in that less than -2.5 range, if you have enough risk factors, if you've had a fragility fracture, you could be considered osteoporosis.
So with pure osteopenia, would you want to give equivalent medicine at that point?
Yeah, so it depends. Sometimes if you have osteopenia, I just say, and you aren't like a high risk for fracture, I would just say make sure you're taking the amount of calcium that we talked about, like 1,200 milligrams a day that you're getting through diet, and if you need a supplement, make sure you're on a vitamin D supplement. And usually, and sometimes that's fine. But if you've fractured and you're in that osteopenia range, then you need to be on some sort of medication to build the bone.
And if you're taking calcium pills, if you take a lot of calcium pills, would that cause your food that you're eating not to absorb as well?
Well, so generally, if you're taking like a calcium supplement, I don't want you taking more than 500 to 600 milligrams at a time because the body will only absorb about that much. in one setting. There's different, and the thing too is there's different types of calcium supplements out there. So, I mean, even if people take the Tums, you know, it will say like 1,000 milligrams of calcium. Really, when you look at how much actual elemental calcium is in there, it's about 400 milligrams. So, to really get that absorption, you have to take it with food too. So, calcium citrate, some people are on calcium citrate, which is a different type of calcium supplement. That can be taken anytime without relation to when you eat or drink. So, but anything else?
So, and then what about other foods that have calcium besides dairy? Because there's this dairy allergy that prevents you.
Yeah, so I do run into a lot of people that just don't like milk or they have a lactose intolerance. So dark green leafy vegetables are really good. So spinach, broccoli, sweet potato has a lot of calcium in it. If you do, like, nobody ever does this one, sardines, you know. Okay. She doesn't. Salmon, you know, the bone in it is, you know, good for calcium. So there's other options out there. But I do find when people come to me, they just don't get a lot of calcium in their diet, and that's that can definitely contribute to just having bad bones. So, yeah. Any other questions? They're all good questions.
Thank you, Rob.
All
I think we have
right.
a couple other people that come in.
Could you tell me a little bit about this Women's Festival?
Yes, the Women's Health Fest is an annual event that we have to highlight women's health, and then we like to bring in some fun and activities for the women to enjoy. We have speaker presentations. We have our women's wellness services. That is one of our clinics that's here to help women with some of the healthcare questions they may have and things that they'd like to know when it comes to their health. We want women to be healthy. We feature lots of things. We have the vendors that support things. We have other services that we feature. One of them is good nutrition. We want to make sure they eat healthy, and that's why we have our Garden of Health. So there's so much going on, so much to see. We talk about cardiac care. We talk about lots of different things in the healthcare arena, and because we want the women of this community to be healthy, and then we try to offer them some fun things. There'll be some massages going on. We have Prism Hair here, who they are doing hair, and we have flowers. We have so many things for the women to enjoy, and it's all mostly free.